Hello, I'm Dr. Lipi Roy, and welcome to my show, Health, Humor, and Harmony. Musician Travis Barker is most famously known as the drummer for the rock band Blink-182, and more recently as the husband of media personality Kourtney Kardashian. On June 28th, Barker was rushed to Cedars-Sinai Medical Centre in Los Angeles with acute pancreatitis. During my medical career, I've taken care of many patients with acute pancreatitis, which results in 275,000 hospital visits in the United States each year. In today's show, I'll talk about 5 things you should know about pancreatitis. Let's get started. Number 1, what is the pancreas and what does it do? The pancreas is an organ located at the back of your abdomen, behind your stomach, and in front of your spine, and it's surrounded by your gallbladder, liver, and spleen. The pancreas is also a gland, which is an organ that produces and releases substances that help with digestion and blood sugar control. The pancreas releases 3 enzymes: lipase, which breaks down fats, amylase, which breaks down carbohydrates for energy, and protease, which breaks down proteins. The pancreas also releases 2 hormones that control blood sugar, i.e. blood glucose: insulin, which lowers blood sugar levels, and glucagon, which raises blood sugar. Number 2, what's pancreatitis and who gets it? Travis Barker, who is thankfully recovering, described his ordeal as a severe, life-threatening reality. Pancreatitis is an inflammation of the pancreas. It can get damaged by the powerful digestive enzymes it makes. The inflamed pancreas can cause the release of inflammatory cells and toxins that can harm other organs, like your heart, kidneys, and your lungs. There are 2 types of this disease: acute pancreatitis, which lasts about 1 to 2 weeks, and chronic pancreatitis, a long-lasting condition where the pancreas does not heal or improve. So who gets pancreatitis? You're more likely to get it if you're male, black, smoke, drink alcohol heavily, have obesity, have a family history of pancreatitis or gallstones, or a personal history of gallstones, or high triglycerides. Number 3, acute pancreatitis needs immediate medical attention. How do you know you're having a pancreatic attack? Travis Barker first felt severe abdominal pain, which in fact is one of the most common early symptoms: sudden upper abdominal pain that may radiate to your back. Other symptoms of acute pancreatitis include nausea and vomiting, fever, fast heart rate, a swollen abdomen, and abdominal pain that worsens with eating. Chronic pancreatitis can present the same way as acute pancreatitis, but may also be associated with unexplained weight loss, diarrhea, and greasy, foul-smelling stools. Number 4, the most common cause of pancreatitis is not endoscopy. While the number 1 complication of an ERCP, or an endoscopic retrograde cholangiopancreatography, let's just stick with ERCP, the most common complication is acute pancreatitis. By far, the leading causes of pancreatitis are gallstones and heavy alcohol consumption. Other causes include medications, high triglycerides, i.e. fat in the bloodstream, infections, metabolic disorders like diabetes, and genetic disorders like cystic fibrosis, which I discussed in episode 30. I should note that the specific endoscopic procedure that Travis Barker underwent isn't clear. On July 2nd, he tweeted, "During the endoscopy, I had a very small polyp removed in a very sensitive area, usually handled by specialists, which unfortunately damaged a critical pancreatic drainage tube." Number 5, pancreatitis can be treated and most people do well. Mild to moderate acute pancreatitis is often treated with a few days in the hospital to receive intravenous fluids, pain medications, and antibiotics. Severe pancreatitis may require surgery, say to remove the gallbladder if gallstones were the cause. If there's a complication like an abscess or an infected pseudocyst, a specialist may perform a procedure to drain fluid from your abdomen or remove damaged tissue from your pancreas. Chronic pancreatitis is managed with medications and vitamins to treat malabsorption, as well as surgery to relieve pressure or blockage of a pancreatic duct, or to resect a damaged or infected part of the pancreas. As a doctor who's cared for many patients with pancreatitis, I know how uncomfortable this illness can be, and I am relieved to hear that Mr. Barker is doing well. I wish him a full and uneventful recovery. And as a patient who has undergone GI procedures, I want to reassure you that endoscopies are very safe and complications are very rare. So, how can you get involved? You can learn more about this condition and donate to some wonderful charities such as the National Pancreas Foundation, the American Pancreatic Association, and the National Organization for Rare Disorders. These organizations work towards researching both pancreatic cancer and pancreatitis. Well, that's all for today. Here's your joke of the day, GI theme. Why did the gastroenterologist walk into a bar, pick up the seat from the bar, then walk out? He was just taking a stool sample. Be sure to tune into my show Monday, 3 p.m. Eastern. Have a wonderful weekend. Take care. Be sure to subscribe to my YouTube channel, make comments below, and follow me on Instagram at Health Humor Harmony Dr. Roy. Be well. I'll see you soon.